Right. If you see today's topic, it's about the role of micronutrients in promoting the diabetes remission. You might have heard about macronutrients, which are proteins, fats, carbs, right? So they also play a major role in diabetes remission. But less of us know about the impact of micronutrients in promoting a diabetes remission. Not only diabetes, you can name PCOS, you can name hypertension, you can name any metabolic disorders. The role of micronutrients have a substantial pivotal role in promoting overall health, especially in managing and potentially reversing type 2 diabetes. So let's understand micronutrients a little bit. What are these micronutrients? Micronutrients are nutrients which are very much essential for our body's enzymatic reactions, hormonal balance, and lot of metabolic processes. మన బాడీలో ఈ మైక్రోన్యూట్రియంట్స్ విటమిన్స్ అండ్ మినరల్స్ అంటాం. లాట్ ఆఫ్ లోపల ఎంజైమాటిక్ రియాక్షన్స్ కానీ హార్మోనల్ బ్యాలెన్స్ కానీ మెటబాలిక్ ప్రాసెసెస్ కానీ చాలా 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 ఉపయోగం. సో పాయింట్ ఈస్, are we ready or are we equipped with the proper amount of micronutrients into our body or not? Are we taking the good amount of micronutrients, or are we including good amount of vitamins and minerals in our daily nutritious diet or not? Or are we taking a nutritious diet at all? అసలు మనం న్యూట్రిషియస్ డైట్ తీసుకుంటున్నామా లేదా? నేను తక్కువ తిన్నానా, ఒక పోర్షనే తిన్నానా, కొంచెం అన్నమే తిన్నానా, డిడ్ ఐ ఈట్ లిటిల్ బెట్, డిడ్ ఐ ఈట్ వెరీ స్మాల్ మీల్స్, డిడ్ ఐ టేక్ a single meal, or did I completely avoided a complete meal? That's not the factor. The factor is something else. In the context of diabetes, the micronutrients influence glucose metabolism, insulin sensitivity, and inflammation. So these three are very major factors, not only for diabetes, but also for PCOS, hypertension, any metabolic disorders, you name them. So how many of you are really taking care of that? How many of you are taking care of it? Are we all taking care of it to make sure? Are you all making sure that your food has the important vitamins and minerals into your diet? Yes or no? You need to think twice before you eat something. ఒక్కసారి ఒక్క 2 minutes you need to go step back and then think about, మనం అసలు ఇవాళ ఏం తినబోతున్నాం, నా ఫుడ్లోకి ఏం వెళ్తోంది, అన్ని ఇంగ్రీడియంట్స్ వెళ్తున్నాయా లేదా, అట్లీస్ట్ నేను తిన్న మీల్స్లో ఆర్ స్నాక్స్లో వైటమిన్స్ అండ్ మినరల్స్ వెళ్తున్నాయా లేదా అని చూసుకోవాలి. ఇఫ్ నాట్, యూ హ్యావ్ టు మేక్ షూర్ దట్ ఇట్ ఈస్ బీయింగ్ టేకెన్ కేర్ ఆఫ్. Right. So what are the key micronutrients for diabetes management? Many of you don't know, or many of you might know. How many of you have really checked how much your vitamin D is? They can all raise their hands. How many of you checked your vitamin D recently? Just raise their hands. No one? How many did you really check your vitamin D levels? I see out of 30 people, I see only 2 people raising their hands. Okay. Not
I have this.
right. How many of you know about the role of vitamin D in diabetes? Okay, I'll tell that. So point is, vitamin D plays a pivotal role in managing your diabetes. It improves insulin sensitivity and pancreatic beta cell function. It reduces the systemic inflammation as well. So if any person who is diabetic and has vitamin D deficiency might face fluctuations in the sugars, and hence their HbA1c might be fluctuating as well. So where do you get this vitamin D? Either you get exposed to sunlight, either you eat anything that is fortified with vitamin D, like dairy products and all, you make sure you eat any fatty fish, egg yolks, mushrooms. These are all good sources of vitamin D. The point is, if you don't know how much vitamin D is in your body, you can never ever get to that mark where you would like to get your diabetes under control and make your HbA1c under the target. సో మీ వైటమిన్ డి డెఫిషి మీ వైటమిన్ డి ఎంత ఉంది అని తెలుసుకోలేకపోతే హెచ్బిఎన్సి టార్గెట్ రీచ్ అవడం అనేది కష్టం. అండ్ వైటమిన్ డి నార్మల్ అయిపోతే కంప్లీట్ హెచ్బిఎన్సి నార్మల్ అయిపోతుందని రూల్ కూడా లేదు. ఇట్ ఈస్ వన్ ఆఫ్ ద ఫ్యాక్టర్ which helps your sugar levels to get into the order of things. It makes your HbA1c into a proper order. It makes your pancreas to produce proper beta cells. It makes your body to produce more insulin. It reduces the systemic inflammation. So body law inflammation taggitene your body starts working properly. So you have to make sure your vitamin D is properly taken care of. So whenever I ask few people, they say like, when was the last time you took vitamin D? Sir, 3 months back I've used the course. I've completed my course. But what after that 3 months? Did you expose your body to sunlight? Did you get your vitamin D? And this season is a winter season. So how do you expect your body to make vitamin D without proper sunlight? So many of us have not exposed our body to sunlight, proper sunlight. That is for sure. So you have to make sure you check your vitamin D properly. And I'll tell you why you need to check your vitamin D before you take vitamin D supplements for the second course. If vitamin D goes excess in your body, there is a high chance that you might face some kidney stones in your body. So that's the reason you have to check your vitamin D and see it is not crossing 100. So the amount of vitamin D that should stay in everyone's body is in between 30 to 100. But we want it to be something around 50s or 60s. If it is between 50s to 60, high chances you don't have low mood, you don't have any body or neck shoulder pains, or any lower back pains, or any knee joint pains, or any ankle pains, anything related to bones, you tell them. It will be reduced. Anything related to low mood, it will go off. So your mood starts getting better. So vitamin D plays a very pivotal role in everyone's day-to-day life. So that's the reason you have to stick on to vitamin D every now and then. And you have to check it out at least yearly twice. Before you use vitamin D, see, mostly previously Indians used to have the best vitamin D available in the body. But now, due to global warming and ozone layer depletion, the vitamin D or vitamin D producing ultraviolet B rays has not substantially been coming into our earth. And so, the vitamin D preparation in our body is a little bit a very difficult task for our body to prepare. So, make sure when someone suggests you a vitamin D supplement, it doesn't mean that they're just giving some supplement. Okay, so that it has a substantial role in reducing your systemic inflammation. So that is very important. Are we all on the same page? Right. Next, have you heard about magnesium? What is the role of magnesium in our body? And sometimes, if you see, I have mostly advised magnesium to few of you. If you see, you might have used Remag or Remag Plus, which has magnesium in it. So this magnesium, if you see the role of it, it is very essential for insulin secretion and glucose uptake. So this deficiency is linked to insulin resistance. When you have magnesium properly in your body, the insulin secretion and glucose uptake by the cells is properly taken care of. If you remember, in our first interaction, I've explained about how glucose comes into the blood and how cells absorb the glucose with the help of insulin. At this point of contact, Magnesium plays a pivotal role again. So it has a very substantial role in making sure that glucose is uptaken by the cells and the insulin is properly secreted. సో మన బాడీలో ఆ సెల్స్ దగ్గర ఎప్పుడైతే గ్లూకోజ్ ఎంటర్ అవుతుందో ఈ ఇన్సులిన్ ఒక కీ లాగా యాక్ట్ చేసి ఆ డోర్స్ ఓపెన్ చేసి ఈ గ్లూకోజ్ని లోపలికి పంపిస్తుంది. ఈ లోపల పంపించినప్పుడు మెగ్నీషియం రోల్ కూడా చాలా ఇంపార్టెంట్. మెగ్నీషియం డెఫిషియన్సీ ఉండటం వల్ల ఇన్సులిన్ రెసిస్టెన్స్ వచ్చే అవకాశం కూడా ఉంటుంది. సో దట్స్ ద రీజన్ we always make sure we put certain supplement called magnesium into your prescription to make sure that it is being taken care of. There's been a lot of research going on magnesium, like how better it could be useful for our body to make proper insulin and to reduce the insulin resistance. So where do you find this magnesium? Of course, naturally, if you want to see, it is available in all the nuts. It's all available in seeds. It's available in the whole grains like brown rice, leafy greens, all the leafy greens. Magnesium is good. Legumes, the magnesium is good. So nuts, seeds, whole grains, leafy greens, legumes. These all have the proper amount of magnesium that is required for our body to make enough insulin. That is one of the factor. So magnesium and vitamin D are very, very, very important for our body. If you're not on any magnesium supplements, it is not bad to use magnesium for some more time. It is something that is useful for your body. Okay, so make sure if anywhere we missed putting magnesium supplements into your prescription, whenever you meet us the next time, you ask for us and we'll definitely put it in your prescription. Right. Next, chromium. Chromium has another role which enhances the insulin action and the glucose tolerance by aiding in carbohydrate metabolism. So chromium has a very pivotal role as well in this glucose uptake and especially in aiding the carbohydrate metabolism. So how carbohydrates gets metabolized in our body and gets useful in the body, and the glucose tolerance. See how much of your body can tolerate the glucose in order to produce enough amount of insulin is also dependent on a mineral called chromium. So where do you find this? Chromium is very necessary. So where do you find this? It's available in broccoli. It's available in all the nuts. It's available in green beans. Beans. Have you ever heard about beans? So those beans, they have chromium. All the whole grains, red rice, brown rice, millets, you name them, they have them. So chromium is such an important mineral that also enhances insulin action and glucose tolerance by aiding carbohydrate metabolism. సో మన బాడీలో ఈ క్రోమియం అనేది చాలా ఇంపార్టెంట్. మన ఇన్సులిన్ యాక్షన్ని బాగా ఎన్హాన్స్ చేసి గ్లూకోజ్ టాలరెన్స్ని మనకి ఎయిడ్ చేసి అంటే గ్లూకోజ్ టాలరెన్స్ చేసి కార్బోహైడ్రేట్ మెటబాలిజంని పెంచుతుంది. అంటే కార్బోహైడ్రేట్స్ని బాగా కరిగించేటట్టుగా చేస్తుంది అండ్ స్లోగా మన బాడీలోకి అబ్జర్వ్ అయ్యేలా చేస్తుంది. సో దట్స్ ద రోల్ ఆఫ్ క్రోమియం. zinc. Next is zinc. So zinc has a crucial role for insulin synthesis and storage. So this is very interesting, guys. If you get to know the minerals that our body needs, zinc is something that our body needs, which is very crucial for insulin synthesis and storage. మన బాడీలో ఇన్సులిన్ సింథసిస్ అవడానికి, ఇన్సులిన్ స్టోర్ చేసుకోవడానికి అండ్ మన బాడీలో ఈ యాంటీ ఆక్సిడెంట్స్తో డిఫెన్స్ చేయడానికి. ఈ యాంటీ ఆక్సిడెంట్స్ మనకి ఏం చేస్తాయంటే క్యాన్సర్ కాజింగ్ సెల్స్తో, టాక్సిన్ సెల్స్తో ఫైట్ చేస్తాయి. సో దట్ పాయింట్ ఆఫ్ టైమ్ దిట్ జింక్ ఇస్ వెరీ ఎసెన్షియల్. It supports the antioxidant defense. So it's like, having some armor when you're fighting, when you're going for a boxing. So you have your arm guards, right? In the same way, it has that defense. So zinc is so essential for us. Where do you find zinc? Have you ever tasted the pumpkin seeds, chickpeas, all the cereals nowadays? All the cereals are being fortified. But watch out, the cereals also have added sugars nowadays. So take only those cereals which doesn't have added sugars. So go for them, but no added sugars. That is very important. And few fish have zinc in them. So pumpkin seeds, chickpeas, and fortified cereals, and some sort of fishes have zinc in them. So having zinc into your body sometimes will also make sure that your body has proper amount of minerals, and this is helping in certain ways for insulin synthesis and storage, which later supports the antioxidant defense. So zinc, chromium, magnesium, and vitamin D. These are the four things that we discussed till now, and they have the ultra most main role in insulin synthesis and insulin storage. Next is vitamin B complex. So this is vitamin B complex is a water soluble vitamin, especially B1, 6 and 12. Vitamin B1, vitamin B6, vitamin B12. This B3 complex, 3B complex vitamins, they are very vital for nerve health, especially which helps in preventing diabetic neuropathy. Many of you have rejected to take vitamin B12 supplements or vitamin B12 injections when advised. They thought that taking injection will hurt them. No, it might hurt manually on the place of site of injection for a little bit of time, but it saves your nerves. It saves you into getting diabetic neuropathy. It also reduces the homocysteine levels, which is the major factor for improving the cardiovascular health. Because cardiovascular health, for it to get improved, the nerves that are connecting the heart and to the other organs is very important. On a very long term of exposure of diabetes, the nerves on a longer term starts to little bit reduce their potential, and the health of the nerves starts deteriorating if sugars are not properly treated. So it improves the cardiovascular health, it reduces the homocysteine levels, it is vital for nerve health, and it prevents in diabetic neuropathy. So vitamin B complex has to be taken, and if vitamin B complex is more than what your body needs, doesn't matter, there are no side effects to it. So if you have taken one more extra injection for B12 or B6 or B complex injection, it doesn't lead to anywhere. It's a good thing, because your vitamin B12 will come down if you're on, especially on metformin. Many of you are on metformin, agree or not? So many of you might be having a lot of B12 deficiency as well, and people who has who have a issue of acidity or gastric issue will definitely have this vitamin B12 deficiency for sure. People who have acidity, gastric issue, digestion issue, constipation, who are on metformin medications, who are on antibiotic medications, the B12 will definitely come down. Hence, you check your vitamin B12 and see how much it needs to be improved. So where do you find this vitamin B3 or B complex? Mostly all the meats, all the fortified foods, eggs, dairy products, whole grains, they have B1, B6, B12. So if you include all these things in your day-to-day meal, definitely it would be an added advantage. సో మీ డైట్లో జింక్ అలాగే వైటమిన్ బి కాంప్లెక్స్ మన నర్వ్ హెల్త్కి చాలా ఉపయోగపడతాయి. డయాబెటిక్ న్యూరోపతి రాకుండా హెల్ప్ చేస్తాయి. బాడీలో హోమోసిస్టిన్ లెవెల్స్ని రెడ్యూస్ చేస్తాయి. మన కార్డియోవాస్కులర్ హెల్త్ని ఇంప్రూవ్ చేస్తాయి. సో ఇన్ని అడ్వాంటేజెస్ ఉన్నాయి. ఎక్కడ ఉంటాయి అంటే హోల్ గ్రెయిన్స్లో ఉంటాయి, డైరీ ప్రొడక్ట్స్లో ఉంటాయి, చీజ్, బటర్, మిల్క్, పనీర్, ఎగ్స్లో ఉంటాయి, లీన్ మీట్స్, ఫిష్, చికెన్, వీటిలో ఉంటాయి, అండ్ ఫార్టిఫైడ్ ఫుడ్స్. అంటే ఫార్టిఫైడ్ అంటే యూ యాడ్ సంథింగ్ ఇన్ టు ద ఫుడ్ టు మేక్ ఇట్ మోర్ రిచ్ ఆఫ్ vitamins and minerals. That is called as fortification. So our fortification low, they're adding vitamin B, zinc, they're adding every vitamins and minerals that they find to make sure your vitamin and mineral deficiency is addressed. Right? Okay. So till now we have discussed vitamin D, magnesium, chromium, zinc, and vitamin B complex, B1, B6, and 12 especially. Next are antioxidants, which we call as vitamin C and vitamin E. So vitamin C and vitamin E, they have a very combat kind of effect on our body because they combat the oxidative stress. Oxidative stress is something that is formed in between the cells, which is a significant contributor to insulin resistance. So cell మధ్యన జరిగే ఉండే స్ట్రెస్ ఏదైతే ఉంటుందో that is what creates insulin resistance and beta cells ని సరిగ్గా ఫంక్షన్ చేయకుండా చేసేవి ఈ ప్రాసెస్, ఈ ఆక్సిడేటివ్ స్ట్రెస్. సో ఎవ్రీ బాడీ విల్ హ్యావ్ ది ఆక్సిడేటివ్ స్ట్రెస్, దెర్ ఇస్ నో డౌట్ అబౌట్ ఇట్. But when you take certain antioxidants into your body, like vitamin C and E, especially, which are very easily available, this makes sure that it combats, it fights the oxidative stress, which is a significant contributor to insulin resistance. మీ ఇన్సులిన్ రెసిస్టెన్స్కి సిగ్నిఫికెంట్ కాజ్ ఎవరు అంటే ఈ ఆక్సిడేటివ్ స్ట్రెస్. సో ఆ ఆక్సిడేటివ్ స్ట్రెస్ అంటే మన బాడీకి ఫిజికల్ స్ట్రెస్ ఉంటుంది, మెంటల్ స్ట్రెస్ ఉంటుంది, అలాగే మన బాడీలో సెల్ టు సెల్ మధ్య ఇంటరాక్షన్ అయినప్పుడు ఈ సెల్యులర్ లెవెల్లో కూడా స్ట్రెస్ ఉంటుంది. దట్ ఈస్ వాట్ ఈస్ కాల్డ్ యాజ్ ఆక్సిడేటివ్ స్ట్రెస్. సో దాన్ని తగ్గించాలి అంటే include the good sources like citrus fruits, bell peppers, nuts, seeds, and green vegetables. They have a very substantial role and important role, especially the antioxidants. So that's the reason we sometimes give you some supplements which have both vitamin C and E and ask you to include citrus fruits like oranges, mosambi, or lemons into your diet. And vitamin E is also produced in all the citrus fruits and bell peppers and nuts and seeds, whatnot. So these are very essential for every one of us, and make sure it is being taken care of. So guys, so till now we have discussed nearly 5 to 6 micronutrients, which are the key micronutrients for diabetes management. And we'll be discussing about them in very detail in our part 2, which is next week. So till now, whatever we discussed, if you have any other doubts, please put it in your chat. Tia, you can unmute from your side and you can put your questions, please. So is it something interesting that you learned today or not? Yes, please. Doubts one by one. What did you understand till now? Questions?
So,
Doubts?
Gautam sir, I have one small doubt.
Yes,
So
this is.
when we are using vitamin B12, correct? This 60,000 IMU, they normally they will suggest to use the codes, correct?
Uh-huh.
The with the fish gel. Is it good? I mean otherwise, because sometimes some people are telling even that, even though that is 60,000 IU, I think you don't get that much of thing, even though after the codes I heard for few people. So
Yeah.
is there is any, other than that, is there any other supplementation which we can get vitamin D3?
See, first of all, as I said, you need to check out how much vitamin D3 you already have in your body. Okay. So accordingly, you need to increase your standards of inputs of vitamin D supplementation. For example, if a person has around 6 or 7 or single digit number of vitamin D, it means that he doesn't have vitamin D at all. It should be at least a double digit and nearly 30. If it is not there, you have to use a course for 8 weeks, which you take 60,000 in IU for the next 8 weeks and make sure it is increased a little bit. So it will definitely get covered till to 40 or 50. And after 2 months, you check your vitamin D3 again. And if it is not sufficient, you have to use another course. There is nothing to do about it. I mean, apart from this, there is no other way. Yeah.
Thank you.
హాయ్ గౌతమ్,
Hi.
రాంబాబు.
Hi. Hi, sir.
లాస్ట్ టైం యాక్చువల్గా బీటల్ నాకు 150 ఉండేది.
Okay.
నేను 7x5 5x7 days 5 times 5 ఇంజెక్షన్స్ చేసుకున్నాను. స్టిల్ యాక్చువల్గా అవి నాకు పాదాలు జస్ట్ బర్నింగ్ సెన్స్ అప్పుడప్పుడు కనిపిస్తానే ఉంది. ఇంకా
Right.
కంటిన్యూ చేయాలనా లేదంటే ఒకసారి టెస్ట్ చేసుకోమంటారా? ఇంకో 1 month కంటిన్యూ చేయాలనా?
Yeah. So check your vitamin B12, sir, first. And then we need to
ఓకే.
see how your nerves are getting affected in your body. See, sometimes some nerves might also trigger that sensation. So B12 ganaka baane undi, B12 sufficient ga undi anukunte ganaka you can stop taking B12 injections or B12 supplements. Only thing that we need to retrospect is the other way of neuro ante nerves ela unnayo ఒకసారి చూసుకోవాలి. Yeah.
ఓకే. వీక్లీ జనరల్ గా మనము నాన్ వెజ్ ఎన్నిసార్లు ఇంక్లూడ్ చేసుకోవచ్చండి?
See, there is nothing. See,
అలా
ఇది దేనికి లిమిట్ అనేది ఏం లేదండి. బట్ జనరల్లీ ఇట్స్ లైక్ అట్లీస్ట్ వీక్లీ ట్వైస్ is something that we advise, or twice or thrice. It depends upon person's habits that they have been from past ages. But minimum is couple of times to make sure that it is included in your diet.
ఓకే.
Yeah.
ఓకే, థ్యాంక్ యూ.
Right. Right. Yeah. Next one, please. Okay. Any more doubts? Yes, no, yes, no. Yes, please. Someone can speak
Yeah.
out from there.
It's Gautam Harsha.
Hi, Harsha. Hi.
హాయ్. ఇది బ్రింజల్ అండ్ గ్రీన్ చిల్లీ రెడ్యూస్ చేయమన్నారు కదా,
Yes.
అంటే అంటే టోటల్ గా రెడ్యూస్ చేయాలా, అంటే దేని గురించి
No.
బ్రింజల్ అండ్ గ్రీన్ చిల్లీ?
Yeah, that's a good point. So, point is, see, I've asked you to reduce onions, garlic, green chilies, brinjal, hing. These these all have a these all have a little bit of negative effect on our brain. Okay. Why? Because they make us more sluggish. When you take, they have a negative effect on your brain and make you feel lazy or heavy or sluggish. They will make you slow down, and your metabolism is taken for a roll. So whenever this happens, these things certainly have certain effect on our body. So that's the reason we ask to reduce it to 50% at least. Yeah.
ఓకే.
Is it okay to take one dose of vitamin D once a month? Yes, if you think if your vitamin D is low, if you're feeling any body pains, or if you're having any lower back pains, or if you're feeling low, first of all, as I said, please check your vitamin D, and then you can go for a monthly dosage. If you want to go for a monthly dosage, you don't need to take 60,000 IU. You can go for 10,000 IU.